Hello and welcome to the Tough Cookie podcast. It's Paula, your host, and today I've got Mike with myself. Mike is a physiotherapist and you've got over 20 years of experience.
Yeah, that's right, yeah.
Am I right thinking?
Yeah.
You've graduated and you specialize in biomechanics, testing and adapting physical movement.
Yeah.
That's difficult.
It is, yeah. It's one of those ones, yeah. But that was my, obviously, a BA honours degree. I've also got, obviously, a master's then in physiotherapy as well.
You are doing a lot of rehabilitation work. You also worked with NHS. You work as well with the semi-professional sports clubs, and then you've got your own practice.
Yeah. So them in the past, it was obviously now I'm more sort of away from the sports side of it as such. But then it's more like to do like sort of working here and then private practice as well. Yeah. So I see a lot of different types of injuries or different types of conditions, but there are the same ones that come up all the time. So things like your lower backs, your knees, and feet as well.
Mm-hmm. Do you get to work with the women who are going through the time of change, perimenopause or menopause, or who come to you with the injuries or with some aches, pains? Do you get to work with a lot of women as well?
Yeah, there is that sort of thing with clients and things, or even when I'm working here at work, potentially because of the job that they do as well. So they either in a warehouse where they're walking all day or on the feet all day, and then some of them might be office space, so they might be sitting all day. So when you do get a woman in, sort of they have different types of obviously injuries, but I can treat anybody from somebody sort of that's having an injury outside of work to those who have injuries within work, but those type of age groups sort of as well. We get sort of a difference, which is quite good. There's a nice variety of ages. But again, sort of speaking about different types of injuries, the women generally have either shoulder problems, neck problems, or lower back problems. So the feet problems, usually I would probably see more men than women in this context within the warehouse.
Yeah.
But again, even my private practice as well, I do see a few women as well. I wouldn't obviously see the same amount, but I do see, them women coming through the door who have got either plantar fasciitis or tendinopathies, which are tendon type injuries, and knee problems. So within my clinic privately, I probably see less upper body than it is lower body.
Is it more mechanical, you think, or is it connected with aging? What is, like, obviously you've got years of experience working with different clients, and those changes, all those injuries, do you think they're driven by mechanical issues or more hormonal changes, more changes that are happening to body because of aging?
I always sort of look at it as layers really of what people do. So it's not just maybe a couple of things. It could be sedentary lifestyles. It could be then an injury they've had. It could be something the way they walk or they run. And then you start to look at, the type of injury. Is it because they've started to work out? And again, their ages as well. It does come into that whole multifactual area, right? So if this lady is going through, whether it's perimenopause or whether it's menopause or then after menopause, then it's that sort of thing. You've got to put that in the factors, when you're actually sort of assessing somebody. Part of the initial assessment would be, depending on, again, the lady's age as such, or if they mention it within an assessment, in your head, you still got to put those type of factors in, with the reduced, especially estrogen, when that reduces, it does have an effect where, as the research says, and as you're aware yourself, it's that scenario where estrogen is an anti-inflammatory. It's very good at keeping the joints healthy. It knocks on to then sort of making sure that the cartilage within the joints are healthy. So when that starts to drop, yes, it could be part of that factor of then once that starts to drop, then you've got the added bonuses of, what are we going to do? And some of them people will go, well, is it just because of an injury? Is it because of aging? And a lot of people are so individual, but as the assessment goes on, you do find a few more traits of maybe, hormonal imbalances along the way. They're the type of things you've sort of got to maybe educate a woman or a man really about how that can affect them. Because again, a lot of women generally may not research a lot, but in the job roles that we're both in, we sort of look at it maybe a little bit more on how it affects their injuries, what they do in work, what they do out of work, and even their leisure things, whether they do go to a gym or whether they just walk a pet or they're with the children. Anything like that does come into play really with things.
So when the women like are complaining that, oh, I've got more stiffness in the morning, especially in the morning, they've got more aches and pains in the joints that they haven't had before, and they may have not changed anything with their lifestyle, but they just like starting feeling differently, and they're thinking like, why is this happening? And they think then, shall I go to someone to check this? Is it normal? Some may be thinking, is it arthritis? Some may be thinking, oh, it's just an old age. And when to actually seek for some help and guidance, or where is it just like, oh, you just get on with it?
And again, that's quite individual sometimes, where, you know, you might get a character of a person who is, oh, it's okay, I've got these aches and joints, you know, in joints, or even like sort of with back pain or shoulder pain. But the little tips really are, you know, yes, everybody may get a bit more stiffness in the morning as they get up, you know, sort of then as they move around. The little things I usually mention to people is that once you've started to move around, do those joints become, you know, less stiff? And if they become less stiff, you're noticing it maybe for more than maybe 3 to 6 weeks, that might be a time just to go to see physio or an osteopath or some medical person. You don't really have to go to see a GP at that point. Maybe after the 6 week, 8 week period, if the symptoms are worsening, if they're not going away, I always advise go to see your doctor, just see what they say, just get an assessment. You know, they will put in, you know, good assessment themselves, the GPs. But if it's like I said, 3 to 4 to 6 weeks initially, and you're still getting these joint aches and pains, whether it's in your knees, whether it's in your back, you know, if you've been decorating the house, let's say, and they go, oh God, I'm really, you know, then again, you've got to be, you know, use your common sense a little bit. At that marker of, you know, 3 weeks, has it lasted? 3 weeks, is it still going on? Are you still getting the pain? Just have an assessment, you know, go to see someone who's obviously qualified, and it might just need that, you know, you might need a bit of stretching, you might need to do a little bit more activity. And the hard thing is these days is that, you know, a lot of people will say, oh, well, a little bit of time. And I've got this problem as well. You know, I speak to you all the time about finding time to do stuff. And the same sort of process is that, you know, even if you do a couple of stretches every morning, you know, sort of, and you can actually go to see somebody, or even a friend might have the same problem, you know, they might give you some ideas of potentially what you can do. Once you start doing that, you get yourself into a nice routine. Then it's surprising how that simple routine might then change the symptoms that you're getting. So you don't really then need to go to see a GP or a physio or follow it on. It's just those little tips, really. So
those aches and pains that comes out of nowhere, that feels like it, are they driven mostly by estrogen changes? Especially when I'm relating to women like over like 45 or 41, at least 41, when those changes are starting. Do you think the main reason for those is because estrogen then affects, or hormonal changes in general affect the body? Or is it something else happening? What is happening on the level of when it comes to muscles, tendons, ligaments?
So within that scenario, again, within the layers that you put into that ball of somebody, you as an individual, you know, I always say something from a Shrek movie that, you know, you're a bit of an onion. You've got so many different layers as you as a person. Then again, potentially, yes, that would be a factor if that woman is hitting 40, 45. The joints will become. The biggest thing with the menopause and perimenopause, like we said, is that reduced estrogen level. Once that starts to then process it and starts to go down, then like we said, it's an anti-inflammatory, so it becomes less anti-inflammatory processes. So therefore, then those inflammation processes will increase. Same sort of thing with your joints. The liquid within the joint will then start to reduce. The hard thing is trying not to worry people. Oh, well, your knees are creaking or they're aching or anything like that. But that's part of that process. So every woman is different, because every woman I speak to, again, like yourself, when you do talk about these times in people's lives, is that then it's like, well, yeah, you know, this could be the problem, but it may not be. But you've got to think as you age. Aging does occur, obviously, but things do maybe fluctuate as they get older. You know, some people are quite okay with it, some are in the middle, and some of them are really bad. So those type of things are well along the way. You know, if your joints start to then dry up, and that's when arthritic things might start to come in, because part of the process of that, of your muscles then trying to keep the joint in that situation of having a nice gap so your knees can move, your shoulders can move properly, that gap will narrow, and then the joints then start to rub against each other. And obviously the cartilage, as you get older, gets thinner, which is again part of the estrogen as it goes through the process. From that, it's then, right, what are we going to do about it? Because once you usually get into the pain, muscle atrophy and the weakening of muscles over time, then the estrogen levels drop, and then that affects it as well. So once the muscles get weaker, the joints become a little bit unstable. From that, the connective tissue, which is anything from ligaments, tendons, they become less elastic. And that's the hard bit, because then people go, oh, I'm feeling a bit stiff. And trying to get that back is quite a long process, especially if you haven't worked out. An office worker, sat all day, the same sort of thing. You know, a lot of people go to work, go home, they have like a groundhog day. They might have a family, they make the tea, all this kind of stuff, and then they don't do any activity at all. So that makes it harder going forwards with it. But then you might find people who are a little bit more active, who find that transition from having those depletions of their estrogen levels, they find it a little bit easier to carry on, even with the rehabilitation processes, to say, well, you know what, you might only need to do this stretch, that strengthening exercise. You may need to maybe look at maybe your sleep patterns, because that over the last probably 5 or 10 years has become more prominent, even with research that says, sleep is very important. And it's then the quality of sleep that you get. That might affect you because of, the hot flashes that women get through the hormonal processes. They tend to then flare up every now and again, sort of all the there.
Making everything else harder.
Yeah, and then that sort of knocks onto the confidence of doing stuff, because when you don't get your sleep, it's a bit of a snowball effect. Then you get fatigued, and then you don't want to do things, and then your mood slightly changes, and then your mood can be up, it could be down. So there is so much things going on, but it's trying to get the person to educate them, because I'm quite a big believer, like yourself, of trying to be preventative more than fighting the fires further down the line. So the more research that comes out, the more we can educate women and men. As a husband myself, my wife has, so she's gone through this process, had, quite an okay time, to be fair to what, her, sort of process has been, and her journey's been through it. But again, some of her friends as well, they've had quite a bad time about it. So, but she's very active, sort of, she walks a lot, she's very active. Yeah, well, don't you know? So again,
I do know.
It's that thing of just saying, right, then, although you're going through these processes, sometimes it's easier to have that pathway marked out for you if you're more also like a bit active before to start off, to say, oh, I'm in a good routine, I know I can change it slightly.
How the routine would need to change then, in the case when somebody's waking up feeling stiff and feeling the joints are achy? Should they do something? Should they just wake up and do stretches? Is it recommended? Should they do, for example, more mobility before weightlifting? What changes would that person need to make to actually decrease either that stiffness, or just make sure that they prevent themselves from the injuries?
Yeah. So again, from that point of view, this is the thing about the stiffness. So the three main carrierways really would be, if you're going to start off at basic levels, then you should be sort of looking at a mobility or a movement flow program, yoga, anything like that, but then include strength training. And again, it's nothing to build your muscles up so big that you're a weightlifter, but it's then to start that process of making the muscles and the actual tendons, the ligaments, that bit stronger around your joints, so they're not then getting unstable. From those two, you're looking at maybe sort of doing a little bit of stretching as well on top of that. And that can be anything from, taking the movement flows or the yoga patterns and taking that into a morning routine. As you're getting out of bed, can you find 5 minutes to sit on the side of your bed to do a few stretches? If your knees are achy, back's achy, can you spend a bit of time just to do that? Do you get a shower in the morning? Do you get it in the evening? Can you find them 5 or 10 minutes where you could then get out the shower, then do the stretches within your bedroom, downstairs, sort of where there's a bit of space, and start off your day doing that process, so you get into the routine of things. Make it a part of the routine, of, and build it in within the day. Exactly, yeah. And it doesn't have to be, again, maybe every day at the beginning. I suppose that depends again on your symptoms. If you're finding it where, like we said at the beginning, 3-4 weeks, if it's a bit achy, a bit stiff, then you can then try it and see. Like you said before, there are lots of things on YouTube, there's lots of things online, but you've got to then maybe be a bit more specific for you. Is there anything else you would recommend for the women who are going through perimenopause and then menopause to make a part, like to protect their strength, to protect the stability and mobility? Is there anything else from the things, because you've mentioned the yoga, you've mentioned mobility, you've mentioned obviously implementing strength as well. Is there anything else they would need
at the point to prevent themselves from injuries, to protect their muscles, to protect their joints? Is there anything else?
Yeah, there are sort of obviously supplements out there, and depending on, HRT sometimes works for some women and sometimes it doesn't. There's a lot of, again, research around the good, the bad and the ugly really sort of with HRT. Some women get on really well. Obviously some people don't, some are in the middle. The other scenario is looking at supplementation of, whether some of the supplements work well, but as long as you research them, and in the worst case scenario, go to your doctor and just say, is there anything other than HRT that you can do maybe more naturally? There are some natural sort of benefits of these supplements. Looking at your diet, there's things that you can take from a diet situation or your nutrition, because a lot of the research as well about women, sometimes when they start to maybe put on weight as well, the first thing they go to is, let's do some cardio, let's do some, CV stuff. And again, the hard thing with that is that if you haven't done that for a while, then going to look at them, maybe do some strength training, because in my mind, if I say strength to somebody other than yourself, who's within the fitness industry, they go, oh God, if I'm going to the gym, I'm going to be. So it's trying to, again, look at that and twist it a little bit.
Yeah.
So even if they do like a diet, where a lot of women, again, will turn to carbs maybe more than, they're running, so they think the carbs will help them do that. But again, it's not that situation with that, allegedly through the research. So you've got to just tweak it for everybody, but there are a lot of things you can eat that will help along the way. It's not going to be a quick fix, because I think we have that conversation of you try something of 30 days and then you see how you are, and then you might swap it a little bit and then you just change it. A lot of, again, people will start to do something and just carry it on, don't see any benefits. But then it's that thing of saying, well, what is out there, sort of to get the benefit from what you're doing. So
would you say the running is not the best thing to do, or you don't really, what do you think about running? I know it was not on the question.
I think, I used to love running. Because again, I played sports, football, rugby, all that. But the hard thing is then when you start to have the hormonal changes, is that then you're putting excess weight and excess pressure on the load bearing joints. So the majority of the injuries that usually occur, or the aches and pains, from what I'm aware of, and then through the research, hips, knees, feet are just 3 of the 5 that are the top 5, sort of injuries or aches and pains that women generally go through. So to find the fact that, your connective tissue, which is again your tendon, your ligaments, and then your muscles are getting weaker, and then that puts pressure on your joints, then again, in theory, to go back to what we're sort of going on about all the time, is that doing that bit of strength work, apart from running, it's this thing of, right, well, can you start off maybe doing it, you go from a walk to then a jog, and then maybe to a run. But
build it gradually.
Yeah, and build it gradually up. And the whole thing is about even the walking scenario. You can walk at a pace, you can walk slowly. The pressure then that is on your joints, especially again, hip, knees and feet, is less originally. And then, like you said, the gradual increase, then you'll know what your body can manage. And, the amount of women, again, that I've seen that sometimes they will start running, I'm going to go running. It's the best thing. And then literally within 2-3 weeks, because the joints and the muscles are sore, they go, I don't want to do that. I'm going to take a break from that. So you've lost their confidence sort of within that area. So then it might be that thing they've got to start again with something else. And to get the buy-in as such, to say, we can get that buy-in a little bit, like to keep them going. I think sometimes it can make it a little bit harder for, again, professionals like myself and you to go, all right, then, well, you've done this. Well, I don't want to do that. I don't want to do this running because I've done that before. Gradual progression, gradual sort of just implementation of things. If you don't want to do it on your own, do it with a family member or do it with the kids. If the kids are old enough, try and get maybe a motivation for you to do that. So then, you might not be going on your journey on your own. You might be doing it with a friend or family member.
Yeah, which can help as well, don't we?
Yeah, totally. Yeah, exactly. Keeping things ticking over.
That's it. With the running, I feel like when I've got ladies which I coach, there are some ladies who started running during perimenopause and menopause, and they've not been running before, and they feel good. But then I've got ladies who were runners, netballers, were super active, and now they cannot do it because the joint pain is just too much. And I see it like it works differently for different women, and it's like there's no one way. I know women who run and feel great.
Exactly.
Running 10K at the same age, and I know women who cannot do it because the body won't take even 10,000 steps walk.
I think sometimes you're right as well, because it's this, that everybody's individual and everybody's symptoms are totally different. You could sit here with another woman again, and you're saying, well, I've had these, and they go, well, actually, I haven't had them. I've had something completely different. So even though we're saying about the running can be the progressive and gradual, if the woman's been running, like you said, since perimenopause and they've gone through it and they feel okay, there's no harm in doing that because they're still, doing an activity. They're still building sort of strength within the run. They're still getting the cardiovascular stuff. So yeah, it's all individual, but unfortunately sometimes, you might get somebody who will try something and then it doesn't work for them. And then they've got to sort of, like we said, start again to a point. And then that's the hard bit of then going, right then. But like we said, just tailor it to you. And if you don't get the whole thing of, well, what can I do? Even to an effect like just getting your heart rate up, low impact exercise, things like, swimming, anything like that. Or if you can't swim, then, there's cycling, if you don't like cycling,
being open for trying different.
Yeah. And that's the thing. And I think sort of getting that message out to, women in general, so even to men, to be fair, it's this sort of thing of, there is people who don't like activity. There is people who don't like exercise and stuff. This day and age, we are very sedentary. We are, sort of not as active as we once were. And the whole quote of, if exercise was easy, everybody would be doing it. Yeah. And I just think you've got to have that, that excuse. And I'm, again, like, I'm a big excuse person, as in, oh, well, I can't do this, I can't do that because I got this and got that. And you then got to then go, right then, you're on at me all the time. What you doing now? What you doing here? What you doing there? But again, sometimes it does help, as in it sets a little thing in my head going, right, I haven't done this for a while. Everybody is so different in what they're doing. And that's what you've got to take into this.
That's it. You need to find something that works for you.
Yeah.
And as you said, I think the good point you made is about the strength training and women who see strength training as making them bulky or they think it's only for men.
Yeah.
And I think one of the things which may not be emphasized enough is that the muscle loss is happening and there is that 3 to 8% muscle loss per decade.
Yeah.
And if they've never done any strength training, resistance training before, or let's say they are 50 for 20 years, they've been already losing muscle mass. And muscle mass, as it's like metabolically active, is actually helping them with maintaining the body weight they want to have. So it protects that independence for the future where they can't do things. It supports the joints as well, so they've got more stability in the body. So I feel like sometimes we think of visual of like how I'm going to look like. I don't want to get bulky, but there's that side of independence, future strength and mobility. Is, I think, it's forgotten, and it's sometimes because we can't see it. We can't see we're losing muscle as such. We just see the woman. I think they see just they putting on weight. The body fat distribution is changing. So now they got carry more weight around the waist, but they don't know what's happening because you can't really connect with the muscles as such when you look on your body, especially if you've never trained resistance training.
Totally.
You're not really observing your bicep getting bigger or smaller. You can't see it because obviously there is the other parts of the body that takes over. And then the one wants to run, wants to go for an hour on cross trainer or do other activities. And then obviously blast cardio, which is not supportive for protecting that muscle mass.
When I see people, especially the workers in the warehouse, a lot of them will say, they do a manual job, which they do. But again, a lot of the time, then they will go home and they'll rest, which is fine. But the other scenario is, we're getting older, the population is, living longer, and a lot of the things will be, and the way it's going at the moment within the community is that the NHS are wanting, government are wanting people to be at home more, to have things come to them. So whether it's a physio, whether it's a nurse, and so they're trying to set up these community hubs where people, if they are poorly because they're living longer, and so instead of going maybe into a hospital for whatever rehabilitation, they're now sort of saying, well, if you can stay at home and get people to come to you, but this happened sort of 20 years ago, where when I was first physio, and there was a community rotation, and you used to go out to people's houses who were either post-surgery. For this whole process of moving forwards, the functional type training is what I always sort of think, right, we can do this as in at home. You can do it with you doing the washing. I always have a big thing about toothbrush things, as in you've got 2 minutes with your toothbrush. Can you do some little squats? Can you do some balance work? Because again, balance is very important, because the way stability goes, especially with the menopause and perimenopause, that stability causes a lot of falls. One of the injuries that come along, apart from like we said about knees, hips, ankles, there's wrists, when we get older, we tend to have a little bit of instability. Some people are worse than others, obviously, because they're balanced. And a lot of people fall and they fracture the wrists. And if they're older, that can be quite debilitating. So, you know, from that point of view of trying to give people an idea of what they can do at home, you know, 2 minutes of brushing your teeth, balancing on one foot, balancing on another foot, that can be quite taxing for people sometimes when, you know, you don't think about it. But
it's a good idea.
It's just 2 minutes of stuff in it. A minute doing one leg, a minute doing the other leg, or doing some mini squats. You know, as long as you don't pull your sink off the wall, you're halfway. Using things around the house is quite a good thing. Your stairs, if you live in a house, you know, I do testing here at work and things, and getting people to walk up just a flight of 13 stairs for 2 minutes. Gets the heart rate going, so you think about the cardiovascular thing. You know, you got a set of stairs at home, they're normally between 13 and 15 steps. You know, even to do that for 2 minutes, you know, that can again, you know, work your lower limbs, work your heart rate, and again, in your mind, you're still doing things. So carrying the washing, you know, things like that, you know, can you carry the washing, bring it back in? Are you doing the lifting properly? Because again, another injury is lower back injuries. You know, as women move forward with this, just as the estrogen depletes, all these little things in your body, especially with connective tissue, muscle mass, it's getting, you know, tighter, it's getting smaller. So if you add that into doing things around the house when you're not working, if you're lucky to retire, then again, you want to be mobile, I'm sure, because, you know, you enjoy your walking, you know, so again, it's this thing, you don't want to be in your 60s and your 70s, and just because you might not have put the effort in when you were 30, 40, going through the menopause, whatever, you then can't go for a walk and things like that, you know, even if it's just up the road, you know, going to the shops, and they're the type of things that as we get older anyway, we tend to shrink. And one big thing as physiotherapists, we're encouraged to try to keep people's range of movement as big as it can be, encourage them then to give the strength training a go, because let's again say you're on your own and when you're older, if you have a fall at home, you know, like we said, you can break your wrist or whatever, but the whole big thing is, you know, could you as a person now, if you had a fall, get yourself up off the floor? Probably, yes.
You have seen my accident around the summer house on the ice. Have you seen my camera recording?
And
I lifted myself up pretty quickly.
So like that, that's great. But as you get older, potentially,
it's harder.
It's harder, and that's the whole thing. So again, trying to promote that wellness of saying, try to get into some sort of routine, you know, and I think the minimum is now, you know, 2 to 3 days out of 7, can you do 15 to 20 minutes of a workout or just do some activity? Can you do that, you know, to keep yourself, you know, the longevity of not being sedentary? Yes, you can have a rest, you can sit and watch Netflix or whatever.
It's so easy though to get comfortable at home when you come back.
It is.
Instead of doing something and forcing yourself to do a bit of movement.
It is. And again, like you're smiling at me now, like, you know, our conversation, because it's that thing of having the children as well. So if you have got a family, then again, it's that thing of, right then, for me anyway, it's like sort of, you know, what the kids do and the kids okay. But then it's that process of going, right, I'll give up some of my time to, you know, either take them to football training or watch them to do stuff or just talk to them in the house or do something with them. But then that, like you keep saying to me, it's that thing of saying, oh, well, you need to think looking after yourself. And that's part of that process, even when you're going through the perimenopause and the menopause and then post everything, it's looking after yourself and trying to have that self-love of just saying, right then, you know, can you look after yourself? You know, this is that little journey that you're on. Yes, it can be tough and it can be tough for a long period of time. But if you, again, I know we keep going on about it, but if you go through that process and then you come out the other end and you've been as active as you can be for you, then again, the process after that does, you know, make that a little bit better towards the end.
Yeah, it's got sense. When it comes to actual practical side of training, before training, would you recommend longer warm-ups for the women who are going through perimenopause and menopause? And I sometimes speak to women and it's like, well, I feel now I need a bit more warm-up. Okay. So they tend to like feel their body anyway in the first place, and they know when they need it. Or is it recommended that with time, you should spend a tiny bit more time on warming up and preparing those joints? So then when you're actually lifting those weights, when you are doing strength training, is then your body is ready to carry this load through your body.
There's always the recommendation of warming up anyway. So, and again, I know a lot of people probably don't. And then it's even afterwards, it's like sort of stretching afterwards, because again, people
there's not many people wanting to stretch after.
Yeah, exactly. You know, sort of after you finish your session, again, the majority of people will either want to get home, get a shower, get off, and that's it. As the recommendations would go anyway, you would always warm up to your level. So like you're saying, if they're giving you that information, I feel a little bit more, I need a bit of a more of a warm up today, or over the, from now on, yeah, do that, because everybody's so individual, you know, but I would spend 5 to 7, let's say, to 10 minutes warming up anyway, especially if you'd maybe doing some strength work. And like we said, it's not maybe heavy weight. It's maybe more the repetition. You're not going to wake up one morning and suddenly, your ligaments are really tight and things like that. It's the progression. So over again, that journey, you may get somebody right to the start that right to the start of the perimenopause. And as you see them through the journey, and they may start off with just a simple 5-minute warm up. By the time they get to the end of the process, they may be spending more time just doing that, the warm up type of things, and because these movement flows now are a lot more. They're not just like a 5-minute thing. They go on for like 20 minutes, and longer. So there's no harm either in doing a full stretching session.
I think sometimes for some women, the time can be constrained, and they already feel so tired with time, because we see children, getting them ready in the morning, then it's work day, then it's picking up children, then looking after house, doing all the house chores, then it's at 9 o'clock in the evening. They barely got time for training, not to think of that warm-up side. And sometimes I think this is like tiny bit of forgotten in a way of like, well, I already don't have much time anyway in a day.
Totally. And it's that thing as well of just, again, trying to be functional within in your house. So if it's that, like I said before, it's finding, when you're doing the dishes, or if you're cleaning the windows, and something like that, where you are stretching up. Can you do a little stretch? Even the big things of that, again, I go about is, if you can do it while you're doing the hoovering, the old Freddie Mercury, sort of doing the hoover, but it then doesn't put pressure on you to then go, oh, well, I've got to find 10 minutes then, or 20 minutes to do a stretch. So don't beat yourself up. Sometimes, doing it during the day, you'll find you haven't got any time. Your body sometimes does need that recharge of not doing stuff. But obviously, if you've got achy joints, it's not nice to go through the process.
No.
It's whether then you can even find a time to relax. It's hard when you've got kids. I always promote the fact that if the kids are with you and they're old enough, get them, make it into like a family challenge or something, or something making it a bit of fun. So if you are in the summer out in the garden and you're, I don't know, playing Twister or something, then again, potentially use that as part of your routine. Sometimes that can be hard for people, like you said, but it's just trying to promote individual work, individual plans, but that can change. So again, you've got to be prepared that as you go through this journey, then there will be changes, and you may have to make a decision of, oh, am I really doing this right? Is this not what I really wanted to do? Sort of, and at the start it was like this. At the end of it, it might be completely different. They might be running, they might be going, actually, if you look back right to the start of this process, I didn't do anything, and now I'm doing this. The same with the strength training. Those 3 things of the strength training, sort of the yoga stretches, sort of then just the exercises or the stretching as well. Those 3 little tips, so if you can just keep them in your mind and then start to process that as you move forward, that's a big plus. That's a big bonus. Sometimes you've got to try to do one or the other, and if you feel you can do more, then great. Not to beat yourself up when you're doing stuff, because again, that can then cause pressure. That can then cause you a bit of maybe anxiety, because you're not then doing what you think you should be doing, because your symptoms are getting worse maybe. But like we said before, 3 weeks, 6 weeks, if they're not getting any better, then go to see the physio first. If it's worsening and it's not getting any better as well, just make an appointment with your GP and just
get it checked
out. Yeah, because it does work, where you sometimes have got to have that responsibility as well to look after yourself. So that self-love, going back to the self-love thing.
That's it. Yeah. It's going to turn into the self-love episode. One question which I had from the group is, what's the best way to avoid weightlifting injuries other than good form, and don't lift heavier than comfortable?
Right. So apart from that process of doing what you've just said, the warm-up then comes into that process, making sure you're not overlifting. It's making sure that you can lift properly. If you get to a point and it's too heavy, then that's too heavy in a way. You've got to start off, like we've mentioned, about gradual things. If you've got a bit of an ache and a pain, in your shoulder, and then you're doing, shoulder work in the gym, it's being mindful of the fact that if it is getting sore or sorer, then you need to then be responsible, take a break, stretch it out for as far as you want to. Just remember that when you are lifting, then there might be a point where you won't lift all the way. If you're doing 3 sets of 10 and you get to the last set and you're struggling with your form, then again, potentially it's this thing of, you're more at higher risk then injuring yourself, than you would be maybe if you just stick to the whole blinkers on, you do 2 sets of 10, you're in a nice form, you're getting full range. So this is
just knowing your limit and doing it with a good technique.
Totally, And like you said, if you're doing a less movement, as in you're struggling, then your technique's then going. So just be mindful of what you're doing really to avoid those little pulls and those little strains.
I've got a lady who contacted me about the frozen shoulder. I've asked you before about this. Did you have actually women who were contacting you, and can you see a little bit of correlation between perimenopause, menopause and frozen shoulder? Is it common for the woman to get it?
So this is when I said about the 5 injuries you can get, or injuries or symptoms you can get and conditions, then frozen shoulder is up there.
Is it?
So again, if you think about what we said right at the beginning about the estrogen levels start to drop, the hydration levels, and then sort of they deplete, and then you get into the tightness of the connective tissue, then obviously the capsule, which is like around your shoulder joint, it's called adhesive capsulitis, which is frozen shoulder. That's just a posh word for saying it. But again, from that just gets inflamed. So part of that process is that from them levels dropping, your estrogen levels, then again, unfortunately, because we get into a point where if they are using their arms quite a lot, whether it's sitting at a desk, it's like then the posture comes into play. Because let's say you are working in an office and you're sat all day, then again, a lot of people will over time, through your hours in the office, they tend to then sag a little bit, and that all comes from your core. But if your shoulders are coming in, then if you think about doing that, closing your shoulders instead of keeping them quite to a neutral position, over time those muscles will shorten at the front. If you add in again the menopausal type symptoms and the connective tissue gets less elastic, then potentially that then will affect your shoulder. And it can be the rotator cuff, so that's the 4 muscles that stabilize your shoulder. The actual frozen shoulder, the capsule of the shoulder, once that gets inflamed, it can be very, very debilitating. Rehabilitation can be quite long. If it doesn't then sort of go to the point where it's getting fixed, you go through the injection side of it. If it's still not getting fixed and you're still really struggling, they look at surgery then. And for me, that's usually the last sort of chance saloon really, where things can get a little bit better. Research with shoulder surgery as well, not just with menopause things. It's that scenario where, the success rate is not that great. There might be 50-50, might be less. So to do all the other things before is really important, to try not to get, shoulder problems. But that then comes back to the individual, what they're doing with the workout, if they are working out, and whether they can then start to strength train the area. Because again, like we said, if you're in that position, or you're reaching things, like we said, I know keep going about being in the warehouse, these type of movements are repetitive.
So it's really much prevention is so much more important than actually then dealing with whatever happens. It's mobility, exercise, implementing strength training, implementing that functional side of the movement, full range of movement as well. Nutrition, so focusing on that anti-inflammatory side of nutrition, just to support everything, keeping active, so still getting yourself outside, then engaging the family when the time is short, so making sure that you do it, or having support group who will actually go on with you on that journey. I think all that is really the base of preventing all those potential injuries, and then supporting health as that process is
and like we said, along the pathway or the journey, whatever you call it, those things might change. So like I initially said at the start, being an onion and have lots of different levels and all the way around, you just take bits out, and like we said, they may change over the years and over your lifetime. Things do change, but it's multifactual, but everybody's individual. So you've got to change that for that one person, and then take out the main things from them, give them a program where they can look at and go, right, then this is what I want to do. Take-home 3 are, like we said, the strength, the mobility, your range of movements, even, you know, sort of just to look at them. Brilliant. You know, that's your starting point. And then you can either stay with them, carry on. If you start enjoying it, maybe then increase it. But yeah, they're the take-homes really, sort of those 3 points.
Is there anything that women in their 40s and over are doing and you think they shouldn't be doing it because it's like, you've seen that question, haven't you? Is there anything like that from the things that you maybe have noticed that they're trying to do? Obviously, you mentioned trying to run and putting all the effort into just cardio and because of the wanting to lose weight. Yeah. And I know that that's probably one of the things that could come into this category of doing too much and focusing too much on the fat loss rather than protecting their muscle strength, mobility. Yeah,
the one thing that's generally I've got through the whole process sometimes with the majority of women is that once this process starts, they will discuss with friends, they will see what their friends are doing, and then they'll go, oh, you know what, that's a really good idea. And that's not really tailored to maybe their symptoms. But then the research does say as well that potentially women try to do the rest thing because they think because they've got stiff joints and everything else and maybe doing, you know, more walking, more things, then potentially that'll make the symptoms worse. So they may think, oh, well, I'm going to relax tonight because that'll help me relax. So then they might have a glass of wine. They may sort of try some supplements along the way. But if you think about alcohol in general, again, the whole thing about it's a dehydrator anyway. So if you go back to your estrogen levels of, you know, the anti-inflammatory scenario, the dehydration of your joints, then obviously that kicks in to obviously the muscles, and then you're getting a little bit fatigued. So alcohol usually, if you've drank in the evening, you don't get a good night's sleep. In theory. So then that knocks on to the fatigue thing. You know, again, with the joints themselves, you know, you usually have a restless sleep. So again, it goes back to fatigue, little things like that. And then trying to find more of a natural way than maybe supplementation. Vitamin D, again, with research is apparently a big thing where, you know, if women have got a lower level, then if they bring that up, then it does help within the whole process. That's individual. So get your blood test done and then you see what's happening. But yeah, so usually anything like that really, initially that I need to relax. I need to make sure that I'm okay. I've had a hard week's work, part of the process, you're going through it, you know you're going to fluctuate maybe, and I'm going to relax, so I'll have a glass of wine or all this kind of stuff. So usually it's that thing of what, you know, coming through to me is that, you know, I don't ask them, obviously, oh, by the way, you're going home and have a glass of wine every night. And that, you know, they'd be like, oh, I don't know what's Mike asking. That relaxation process, that maybe looking for an alternative, natural way of trying to help, that'll then support. There's lots of things out there now that are more natural. It's trying to, if the HRT is not for you and the supplementation is not for you, then is there anything out there potentially natural wise that you could potentially grab hold of and go, oh, you know what, I'll try that. Because sometimes, unfortunately, it is a bit of trial and error. It is this thing where, although we're saying... Which can
be quite frustrating, I think, for women, because they may be trying and they maybe not working, and then, or maybe they may go to the GP or ask for HRT, they get a HRT, and then it's not really working for them for any reason. They just feel they are not really understood and they're not listened, and then they just feel like, oh, nobody really cares, and they are left a bit like in that feeling of despair and a bit of like frustration because obviously they keep trying different things.
Yeah, totally.
I think that's all for today then, Mike. Thank you very much for your expertise. It's been very, very helpful.
Thank you for the invite.
Thank you for being my guest. And I think we've covered so many different areas, and you are expert and you know like quite a lot with based on your experience with working with different people. So it's been very much appreciated that you shared it today and put some self-love topic as well in place.
Well, thanks for the invite. And again, if any more questions come your way, you know, I don't mind answering them at all. You know,
I'm going to tag you anyway, and I'm going to put your details. So if anybody's got any questions, if they've got any injuries, if they've got any problems, they can reach out. Obviously, you're in our local area of Barnsley, so you're not far. So if anybody wants to reach out for you, they'll be able to contact you and direct. And if they know that something is really bothering them for longer than 3 weeks, as we said, and they actually want to get it checked or get support or have a little routine they can put in place to prevent those injuries going forward or make themselves feel better and get back into that, feeling a bit more mobile, then I'll tag you in as well so they can directly contact you as well.
Great, that's it.
Thank you
Happy
very much.
to help as always. Thank you, Pauline.
Thank you, Mike.
Brilliant.